We are the Multispecialty Sonography class of 2016,
and we want to tell you about our program.
A diagnostic medical sonographer is an imaging specialist who uses sound waves to image the various parts of the body and pregnancy for diagnostic purposes. One of the interesting facts about our program is that you can sit for your boards before you graduate, so on the day of graduation you're already registered. Our program is a 2-year associate's degree, but you can also do the bachelor's degree completion if you would like. Some of the exams that we perform are abdomen exams, OBGYN, thyroid, breast, and scrotum. Some of the specialty procedures that sonographers assist with include things like needle guidance for paracentesis and thoracentesis, also amniocentesis for pregnant expecting mothers.
In your first year of the multi-specialty program, it is a lot of class or based work. You will also be participating in lab. This is when you will be learning a lot about the normal anatomy of the human body.
Does this image of the kidney look okay?
I think you could just get rid of that rib shadow there. Maybe elongate it out a little bit more.
Okay. Second year of the multi-specialty program, it is a lot of clinical-based practice. You will be learning about pathology, which you will be seeing and scanning in clinical.
In your first year at NMC, you can expect to take 4 to 5 classes a week. You will also have labs at these times. For your first year, you can expect to study 1 to 2 hours per credit hour. At your second year at MMC, you're going to be doing a lot more clinicals. You go to clinicals 3 times a week for 8 hours a day. During the downtimes, you can use this time to study. The other 2 days of the week, you're going to classes.
Speaking of clinicals, while you're at NMC, you'll be traveling to different sites throughout the Omaha metropolitan area. Some of these as far as Red Oak, Iowa. This is a great experience. We have 3 sites in particular that are very interesting. Our first site, Pope Paul, you'll actually follow a woman's ovulation cycles. Our next site, the Perinatal Center at Methodist Women's Hospital, is a high-risk OB department where you'll follow multiple gestations closely. Lastly, there's Children's, where you'll be scanning from neonates all the way to the pediatric population. As far as your other sites go, you'll be sent to various hospitals and clinics where you will critique your technique on abdomen, small parts, and OBGYN exams.
Even though Nebraska Methodist College may seem small, it is jam-packed with a bunch of activities and groups for people to join. Campus life on here helps develop all these future healthcare providers into more well-rounded individuals. You also have access to the library, computers, and printers on campus to help you with your schoolwork. There is also a gym that you can use to relieve stress, and also you can use it as a study break. So how would you describe your learning experience at Nebraska Methodist College?
I have loved my experience here as a student, and I can't wait to use the knowledge I've gained here out working in my career field. Because of Nebraska Methodist College, I'm now an educated citizen working as a healthcare professional.
So what would you say is your favorite thing about being a Nebraska Methodist College student?
I would say that my favorite thing is all the hands-on work that we do. We begin in lab and we get to spend 8 hours 3 times a week at clinical, so it's a lot of hands-on experience.
So what would you say have been your most memorable moments during your time at Nebraska Methodist College?
I would say if you're a student at the school, you're going to have a lot of memorable experiences. But I would have to say my most memorable is when I was at clinicals. The first time I ever recognized a pathology, that just really enforced what I'm learning here.
Thanks for watching!